Hi, Angie.
Hi.
Maybe
Yeah, what about?
make
I have a webinar, yeah.
Oh, okay.
Yeah, why?
So just one. Actually, from CRA, there is an inquiry that I was on LOA from March 21 till May 22. I need that letter.
Oh, Sylvia's away already. Did you send her an email? When do you need it?
I sent her email. It's okay. Just like, can you just so somebody can pick because her serious. She's working here. She's
Yeah.
living with me, so she can pick that letter.
Okay, so but not your man. Oh,
Because I
okay.
went
Why don't
to
you go to Mary? Mary, the office manager.
over
Yeah,
upstairs. Okay.
yeah.
Thank you.
All right.
Thank you.
Hey everyone, how's it going? Can y'all hear me okay?
Josh, all good. Thank you.
Awesome. Sounds good. Sounds good. Okay. Well, thank you everyone for logging in today. So my name is Joshua Parker. I'm one of the educators with Gaumard. I work out of the Waco, Texas office. So I'm coming to you all from Waco, Texas. Today's webinar is going to be on the Susie 901. So we're going to talk about a lot of different things with the Susie 901. So Danielle, are you there? Can you hear me?
I'm here.
Hey, did you want me to kind of just get started now, or do you want to wait a couple minutes to see if some stragglers come on, or how do you want to do
I
it?
think there's a lot of content to cover. So if we could, maybe we can get started. And are we okay to record?
Yes,
For people
actually, I'm glad you reminded me. Do you record it or do I record it?
Mosin, do you want to record?
It seems already recorded.
Okay, no.
Oh, actually, it is. Yeah,
He's already started.
All right, cool.
Excellent. Thank you.
Awesome. All right, so yeah, we could do that, and then I guess if other people sign on, we can
don't
kind
hear
of get them
anything.
caught up as needed, or yeah. Okay. Sounds
Angie
good
says
here.
she can't hear anything.
Maybe I'll just gonna
Oh.
go upstairs. Okay.
Oh, maybe it's her speakers. She can turn up her speakers.
You got it.
Okay, sorry, I had to put my phone away, and I think I put it on silent, but we'll see. All right, so basically, the way that the training is going to work is we're going to talk about the Susie 901. We'll probably start with probably like a head to toe of the features and how a lot of those features work, and then we'll kind of go into the software. So the thing about the Omni 2 software, so the Susie 901 with the Omni 2 functionality is basically, think of the Susie 901, she's like our mid-fi Omni 2 mannequin. So the Omni 2 system is the app that runs off of the Android tablet, right? So with your Android tablet, and the Omni 2 system goes, like really like think about it like an app. So kind of how the training is going to go is the best way for me to kind of show you how the software works is through my Surface Pro. But my Surface Pro is kind of emulating the software. I have a software emulator that can emulate and basically kind of simulate running Omni 2, but I don't have the Bluetooth capability to actually connect to the Susie 901. So basically, my tablet there is connected to the Susie 901, but I'm going to kind of share my screen and show you the software through my Surface Pro. So it's going to be a little different, but I'm going to make it work, and it should be a really good experience, and you should be able to see everything really well. Throughout the webinar, if anybody has any questions, definitely feel free to shout them out, and we'll answer any questions you all have. But yeah, so basically the Susie 901 is a mid-fi simulator. So if we're starting up at the very top, she does, have the realistic hair. She has a wig. Basically, if Susie was a real person, she is, I believe, about 5'5". And I don't know what that would be for international. So yeah, Ryan's gonna figure it out for me. So yeah, and then in pounds, she's 40. So what is that in kilometer or kilograms?
Usually 19.
Yeah, like 19 kilograms. So that's kind of how tall and how much she weighs. So starting at the very top with her eyes. Okay, 165 centimeters. There you go. Okay. Sorry, I'm not used to that. Okay, so starting at the top with her eyes. Now, as far as her eyes go, her eyes, think of them as kind of like the doll eyes, right? So her eyes do have the capability of changing. Now, she doesn't have the blink feature, okay? But she does have different capabilities as far as her pupils go. So if I come over here and you can actually tell, so right now she has the normal pupils, right? So kind of like they don't do anything, they don't change if you were to put a pen light there. But if I kind of flip them over, they can flip over. And I could make them, constricted. These are the constricted ones. And then if I go again, I go the other way. And so then now they're constricted. So you have dilated, constricted, and then normal. So if you ever wanted to simulate drug overdoses, or if you ever wanted to simulate a head injury, like that would be a good head injury, right? So she does have that capability. Okay. So with the Susie as well, okay, so kind of moving down the line. Okay, she does have emergency airway device capabilities. She does have the capability of being, you can use a feeding tube with her. Okay, so you'll notice that there's an opening right here. This is kind of where your feeding tube, and if you use like a NP airway, like a nasopharyngeal airway, it would go here. If you use a feeding tube, it would go there. If you use an NG tube, it would go there. Okay, so that's what this side is for. Now, what I always recommend is if you can, try to use a weighted feeding tube. Okay, because you can use any feeding tube, honestly, or NG tube, but I've always found that the weighted ones they go down a lot easier. Because sometimes it basically your NG tubes and your feeding tubes will follow a specific track. Okay, it follows a specific track and it goes down into her esophagus. Okay, so like I like to use one like this. Okay, it's like a weighted one. Okay, so because it's weighted down here, it's really easy to go down that track and everything is very easy to advance. If it's not weighted or if it's smaller, thinner, a little bit more floppy, it can kind of bunch up in the back. So you got to be very careful when you're placing it and you're placing that NG tube and you're going down, that you don't want to bunch up that tube in kind of like the back of her throat. You want to make sure that you're going down that track. Okay, so here, let's see. I think I can do it. Let me try it with her. I'm going to try it without mineral oil. We'll see how it goes. So basically, we're going to go down and let's see. I don't think it's getting bunched up. It might be. I might have to lubricate that. Yeah. I think it's getting bunched up. Here, let's lubricate. And you can kind of see it in the back of the throat. If you do that. Let's see. Let's try that. Okay. Now, the cool thing with this is always keep in mind that your Susie does have kind of like a little digestive system, right? So she has a stomach, she has an esophagus, she has a rectum, she has, the ostomy sites, your G tube and ostomy site bags and things like that. So when I think this is too big for her, honestly. I gotta make sure this is the right size. I think it's too big. Oh wait. Did I get it? Or is it bunching up? Yeah. Yep, it's bunching up. That's okay. All right. So if you do this, if you place it, okay, you will be able to induce fluids. And if you push hard enough and you're auscultating the abdomen, you can actually hear bubbles. Okay, if you put fluid in her stomach, and we'll kind of talk about that. Okay, but as far as the nose goes, okay, I think this is too big. I can get a different size, but that's okay. We're good. As far as that goes, okay, like I said, OP airways, NP airways, she can be intubated. The other thing to keep in mind is that you can irrigate her eyes. Okay, and then as far as that goes, we kind of talked about, you know, moving the eyes to get the different pupil dilation states, whichever you like. Okay. Now, as far as your ET tube placement goes, for ET tubes, you can use ET tubes, LMAs, King airway devices. We talked about the emergency airway devices. Now, she is going to have a sensor in her trachea. Okay. Now, keep in mind, she has a sensor in her trachea, but no sensor in her esophagus. Okay. So if somebody goes to intubate her, you're going to get the notification on the Omni 2, on the Omni 2 tablet, that they've intubated correctly. But if they intubate the esophagus, there's no sensor in the esophagus, and you won't get a notification. So it's kind of like your sign, right? So if they don't get that notification, then that means they're probably in the esophagus. Okay. All right. So as far as your sounds go, okay, we'll kind of talk about sounds and pulses while we're here. All right. So with your sounds, you're going to have throat sounds, heart sounds, lung sounds, bowel sounds, things like that. Okay. The thing to remember about your lung sounds is that they are anterior only. So anterior, right, and left. Okay, so if you take your stethoscope, listen anteriorly, you're going to be good. You'll be able to hear it. She does have several different pre-programmed heart and lung sounds, but just keep in mind they are anterior. Okay, she does not have posterior. Okay, now your trach or your crike, your emergency airway, okay, down here in her throat, right? Trach or crike. Keep in mind, okay, it's always open. This is always open like that. So basically what that's meant for is that's meant for placement and simulation, okay? So if I pull this back, if I pull her throat back here a little bit, her throat skin, you can kind of see there's like a piece of tape right here. So she comes with a roll of tape where you can replace this, because basically this tape represents her cricothyroid membrane. Okay, so when you puncture through that, this is actually her airway, and you can simulate placing, again, like a cric or a trach or whatever, and it's meant for like trach care and things like that, like irrigation, cleaning, taking care of it, things like that. That's what it's meant for. It's not, you're never going to want to, you're not going to want to cut this or do like an emergency airway procedure. It's mostly for placement. Okay. So I've always said, in sim in general, that there is a performance feature and then there's a placement feature. Right, so a performance feature is something that you would do like the same way you would do it on a regular person. A placement feature is something that you would place and then teach your student like how to care for it, irrigate it, things like that. And that's what that is. Okay, it's for placement purposes only. Okay, so also with Susie, okay, you're gonna have carotid pulses. Let's see if I can find it. There we go. Yeah, so bilateral carotid. Okay, we're going to have brachial. radial. Okay. Femoral. Your femorals are here, these little tabs. Okay. And we're also going to have, let's see, no popliteal. So no popliteal, but you are also going to have pedal. So the only pulses that you're missing with her are going to be popliteal. Let me double check this one. Yeah, no popliteal. Okay. So carotid, brachial, radial, and femoral. And pedal, sorry, thank you. Okay. So moving on kind of down to the chest area here, you do have 4-lead capability. Okay, so your 4-lead. Now, what your Susie looks like could be different than mine. Okay, mine is an older model. Mine has the gold patches. Okay, so some may have the gold patches, some may have the clips. Does anybody have the clip style? Do y'all know what I'm talking about? Does anybody have the clip style for the 4-lead? Or does everybody have the gold patch, the gold leads?
Most in this group would have the gold leads.
Gotcha. Okay, cool, cool. So with the gold leads, you're going to use your own sticky pads for your monitors, right? So you have the gold leads, and then you have your defib, which is a little bit bigger of a patch. Okay, so you have one here, and then you have one underneath the armpit. Okay, so you're going to get sternum and apex placement. Okay, so you can defibrillate your Susie with real electricity. Okay, so keep that in mind. Kind of basically the way it works is as long as she's dry, as long as she's in good operating order, you know, everything on the chest skin is connected, nothing was removed. Basically what happens is you shock her with electricity, it goes into a capacitor. Okay, all that electricity goes into a capacitor, and then it is dissipated through heat. Okay, so just kind of keep those in mind. You can do that as well. So as far as, you know, blood pressures and things like that, your blood pressure is going to be, let's see, yes, it's going to be a modified cuff on the left side. Okay, so you have a modified cuff, and I'll kind of show you what that looks like. Basically, you're going to put your cuff here, and we'll kind of demonstrate. So you're going to put that cuff here, okay? And then your corticoff sounds are actually going to be right here at the base of the bicep. Okay, so right here. Now, you might notice that there's kind of like a little black dot here where her AC vein would be. Okay, that's actually not the place where you do the corticoff sounds. This right here is actually her microphone. Okay, so you can do streaming audio with her. You can also listen through her. Okay, so that's what this is. That's her microphone. Okay, where you actually get your corticoff sounds is right here. So you're going to use a real stethoscope, and technically you're also going to use a real blood pressure cuff, but kind of keep in mind that your blood pressure cuff has an extra tube on it. Okay, oops, sorry. Your blood pressure cuff has an extra tube on it, okay, that comes off of the gauge side. Wait, can I see? Okay, cool. So it comes off the gauge side. So basically that tube goes into the shoulder attachment here, the shoulder port on her back. So on her back shoulder, her back left shoulder, there's a port there, and that's where that blood pressure cuff goes. So basically, the whole purpose of a modified blood pressure cuff is basically that there's a sensor in her shoulder, a module, that reads the same amount of pressure that you're putting on the gauge. So as I'm doing my blood pressure and that pressure is going up on the gauge, it's also being read through Susie. And what that means is basically your blood pressures are more accurate because the mannequin is actually reading, okay, the same pressures that you're reading on the gauge. Okay, so I'm just going to place the blood pressure cuff the same way. Okay, this would go over here. Okay, and then we would do our blood pressures with the normal regular stethoscope and everything. Like I said, I would get my Korsakoff sounds about right here. Okay, so about right there for your Korsakoff sounds. Now, the good thing about the modified blood pressure cuff is those don't have to be calibrated, right? So as long as you're using your modified cuff and you plug that port into the shoulder there, it is reading the same, like I said, it's reading the same thing your gauge is reading, and your blood pressures are really accurate. Okay, those do not get calibrated. Okay. All right. Now, the other thing to remember about Susie, at least this Susie, your Susie 901, is that you do have a respiratory rate. You can kind of hear her breathing. You can adjust her respiratory rate, but she doesn't have chest rise, right? You can probably notice that I'm not getting chest rise on my Susie 901 because she does not have chest rise. However, she does have chest rise with BVM. So if you're bagging her, you will get chest rise with your bagging. Okay, and then she does have the interchangeable breasts. These do come out. They have different lumps and bumps in them to represent different things. And these are removable. I believe you get 2 extra with the 901 that are replaceable. But the easiest way to kind of take these out and adjust them, so we'll kind of do that, is I always do it from the top. So I'll take it like this. We'll go from the top. Okay. And then you just kind of pull them out this way. Okay, pull them out from the top here. And then I always make sure that I keep them in the case. Okay, always make sure that if they're not on Susie, that you kind of keep them on the case. Okay, just because they are silicone and you don't want them to lose their shape. So I always keep them in the case. Okay, so your case is gonna be like that, right? So we take one. I'll put it in. It's a puzzle. Oh, so this one's over here. Let's see. I think like that, maybe. See, hold on. I'm not good at puzzles, obviously.
You're wrong. Put me backwards.
Put me backwards. Oh my goodness. Help me out. There we go. Perfect. All right. So I always keep them in the case. And then your case has a cover. And we will put these away. All right. So now that her breast inserts are out, you can kind of see this spot right here. So this spot right here, this is where your heart sounds are going to be. Heart sounds, lung sounds, things like that. Okay, it's kind of like the speaker right there. Okay. All right. Moving down. Although before we move, does anybody have any questions so far?
A good number have the interchangeable chest skin for the flat chest or the male chest skin. They
Oh,
just
okay.
need to see how to take that off and on. That would be great.
Yes, absolutely. So I don't have the same skin tone for that, but basically your chest skin is going to be right here. Okay, so it's going to kind of look like this. Okay, this one's actually for my other Susie. So here, let me show you. So basically the way this is going to go, let me take this off. Okay, so you have your 2 adapters here, your screw pieces here. So we're going to take these off. Okay. Okay, then we're going to take it off this way. Take it off this way. Try not to, so very important, when you're doing this and you're changing out the chest skin, don't pull this out and try not to push it so far that it goes all the way to one side or the other. Because basically getting this through is very difficult. It's very difficult. So try not to get this bar here out of place because it basically connects her chest with her abdomen and her pelvic area. So yeah, don't do that. That will be a hard day. Trying to get that back on. Okay, so we're gonna take off the chest skin, and you're gonna notice. Okay, so for my leads, I have a cord here. Okay, so we're gonna take that cord and we're gonna pull this off. Okay, so here we go. Out with the old, or out with the female chest skin, and we'll place the male chest skin. Right. So kind of just the same way we took it out. Okay, so I'm going to attach my lead cables. This is for electricity and it's for your 4-lead. So remember, another thing you want to make sure that you don't do is don't put electricity through your 4 leads. Okay, only defibrillate through the defibrillating patches. I don't know if I'm getting this on the side.
So down.
Shit, that's upside down. Okay, so we're gonna go like that. And I'm not gonna put this on her because it is different, but basically same concept. You attach the cable, take this right here, okay? This goes through the metal bar to thread on, okay? So this connects here. This one will connect on that side, and then you have Velcro on both sides. Okay, to Velcro at the top and Velcro on the sides, and you just kind of tuck your battery back in. Okay, so that's kind of how you change out the chest skin. Very, very easy. Okay, now since her chest skin is off, you can kind of tell we have a rib cage here, but you also have, you can see your speakers. Okay, so these are for your lung sounds. Remember, they're anterior. Okay, so lung sounds and then heart sounds on this side. Remember? Okay, and then these are her lungs. Like I said, she doesn't have chest rise and fall, but if we were to get a BVM and we were to bag her, these would go up and down when we bag her. Okay, and this is kind of like your battery connection and things like that. Okay, so we're gonna put this back down, put this back. On the cable. All right. So any questions with the chest area or the face? Okay, let's talk about the abdomen. Okay, so remember I said she has kind of like a digestive system, right? So you can do a feeding tube, NG tube. Always remember only fluids, okay? Only fluids, okay? Don't do anything pasty, don't do anything solid, because basically down here at this part of her body, there's a little splitter, right? And basically what that does is it takes the fluid from her esophagus and puts it into her stomach. And it can get clogged right here if you do anything extremely pasty or anything solid. So it's only fluid with her. Okay, so for her stomach, there's 2 ways that you can fill it. Okay, I can fill it through an NG tube or a feeding tube and it goes down, or I can fill it through here. So this port is how you fill the stomach. Okay, so if I take my filling syringe, sorry, if I take my filling syringe, I can place it here and we can fill her stomach. So let me kind of pull this back. I'll kind of talk about some things. Okay, so her stomach is right here. Okay, so I have one taken out that I can show you. All right, so my filling syringe, right? So here's my filling syringe. So basically, I can fill it through here, right? Place your syringe. Always, 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 when you place it, it goes a certain way. Twist it to the right to lock it in. Okay, and then I would fill with fluids. This fills the stomach directly. Okay, so the stomach actually inside of her looks like this. Okay, holds about a liter of fluid. Okay, so the tube that goes down to her esophagus actually connects to here. So it's kind of like that. Okay, so the tube to the esophagus connects to here. Okay, so if when you're filling from here, there's a tube that runs into here and it fills the stomach. This is actually her rectum. So this piece goes out to her rectum. Okay, so again, enemas, things like that. Now, one thing you want to be careful with is that if you take this out to clean it, okay, basically what you would do is you would take that tube. So that tube is right there. This is the tube that goes to that splitter that goes up to her esophagus, right? So you take it off here, but then there's actually a gray connector piece where her rectum would be, and that's where the red tip of her stomach just connects to. You just slide it in there. You just place it in there. There's no twisting, there's no locking, there's no nothing. This one, however, does lock into place, and you use this tab to take it out. Okay, but this does not. So very, very important. If you take out her stomach to clean it or anything like that, try to make sure it is as empty as possible. Okay, because if there's any fluid left in here and you're not careful, okay, the fluid could leak out, especially right here, okay, because it's not blocked off at all. It's just an open port. So fluid could leak out. I say that from experience. So don't do that. Okay. All right. So her stomach, that's her stomach. Any questions with that? Any questions as far as how her digestive system kind of goes down and things of that nature? Okay.
Can you kindly show them how to empty it? Just pull back on the syringe.
Oh, yes, yes. So yeah, as far as emptying it, that's a good question. So basically what I would do, I guess it depends on what kind of fluid you're using, exactly how clean you want it to be, as far as emptying the fluids and whatnot. You could either take it out, okay, like this, or you can pull fluids from here as well. Okay. Now you don't necessarily you can pull fluids from an NG tube or a feeding tube, but it'll take a long time, right? And you can pull fluids from here. So, and let's talk about cleaning, right? So cleaning and things like that, cleaning and flushing. So you can this is a two-way valve, okay? It's a two-way port. So I can put fluids in there and I can pull fluids out here. Let's see, let's do that. Because I have some alcohol water. Let's do let's see. Let me get some. Okay, so I have a full syringe full of my alcohol water. So when I say that, basically what I mean is it's a 70-30 mixture, okay? So 70 parts water, 30 parts isopropyl alcohol, okay? And you're going to use that to pretty much flush everything. The only thing that you don't want to flush with the alcohol water mixture, and this goes for all of our mannequins, right? This is for everybody, not just the Susie, is you don't want to flush the mannequin's bladder with the alcohol water mixture, okay? Because there's a duckbill valve in the urethral area that the catheter will pass through that prevents leakage of that catheter, and it ensures that your urine goes through the catheter and not around it. So the alcohol is bad for that duckbill valve, and it could kind of get brittle and crack over time and then leak. So we always suggest not using the alcohol water mixture in cleaning the bladder, just use distilled water. Okay, but since I'm just doing the stomach, this is going into the stomach, we're good. Okay, so I'm gonna place this again, and we're gonna put in some water. Okay, so we're gonna go in there. Okay, and then again, it can come right back out. Let me see if I can get another one. Let me see how many of these I can get. Okay, so I got another syringe. Do it again. And then basically what I'm going to do is I'm kind of flushing it and I'm kind of cleaning it, right? So I'm going to flush that in there. And then let's see if I can get some out. We're going to try to pull it out. Let's see how we're doing. Oh yeah. Yeah, it's in there. As you can kind of tell, we got some fluids there, right? So this is kind of where it splits, right? So your splitter is here. I don't know if y'all can see that. There's a splitter here. So this splitter part of it is going into the stomach. The other part goes up towards the esophagus. Okay, let's do a couple more just so I can make sure I get fluid out. We'll do like one more. See what we get. Do this. Okay, I don't know if y'all can see. There's some fluid in there. Let's try to pull some stuff out. There we go. So we'll pull it all out. Okay, I don't have a lot in there. So it's going to take me to kind of moving the bag around to get it back out, but you can pull fluids from here. Okay, so you can pull it from there, or you can pull it from the NG tube itself. Okay. See if I can get some more. Let's do it this way though. To move the bag around to get the rest. Okay. Any questions with that? All right. So Susie is your OBGYN mannequin, right? So she has a urinary bladder and she has different cervical and uterine attachments. Let's talk about the urinary bladder since we were talking about the stomach, okay? And we'll also talk about the ostomy sites. So the bladder holds up to 200 cc's. This does, expand pretty well, okay? Underneath her bladder, you have your uterine and cervical attachments, and we will talk about how to do that, okay? So the way you fill this is you have to actually fill it through the urethral opening. Okay, now let me see what she has. She does not have the piece. Okay, so very, very important, especially those of you that do use the male chest skin and the male attachment for the vaginal area and the male penis attachment. Okay, so in the urethral opening, there is a attachment that looks like this. Okay, and it comes out. This is very important. Okay, so you have this piece. So this piece, you'll notice it's got a little smaller opening right here. Okay, so what this is this simulates the urethral opening, right, for a female. So when you place the male attachment, you take this out. When you fill the bladder, you take this out, okay? So basically, it creates a larger opening when you take this out. So this is what I'm catheterizing. When I'm filling it, I take it out. There's a larger opening through the urethral opening, and that's how you fill the bladder. So you're going to take your syringe Okay, now I don't have it here, but basically it's kind of like your IV drain tube, but it's smaller, right? So one end would go on your syringe, the other end would look like this. So again, I apologize, I don't have one, but basically it's an end that would look like this, and then the other end would go on your syringe. So what I would do is I would fill my syringe with urine, take this tube, and you will not mistake it for what it does because it's the only one that kind of has this type of regular, just tubing type ending. Okay, so I would take this tube, put it through the urethral opening, and fill the bladder. Okay, and then when the bladder is full, take it back out. Okay, I would put this away, and then I would put this back in place. Right.
For the female.
Yeah, for female. For the male, this does not go back in place. Okay, so let me show you real quick. So basically, the male attachment would look similar to this. Okay. Oh, and there's another piece in there. That's good. Because these pieces are easy to lose. Make sure you don't lose this. Okay, because basically with the male attachment, okay, so you have this piece here. Okay, so it's a larger opening, right? This is not going to fit through that. So you take this out, and then this piece goes onto that hole, that same hole where the urethral opening is, okay? And it connects, and it's actually water. Like water will not leak around it because it has that gasket. Place it, and then you Velcro it on, okay? So that's how the male attachment works for Susie, okay? So yeah, so don't lose these pieces. Very, very important. Okay, any questions with that? Okay, so as far as your ostomy sites, right? Like your G-tube, things like that. Technically, they are for simulation purposes. They basically share a reservoir bag. Okay, so you have a port here, an attachment here, an attachment here. So here and here. They basically share this bag and they just snap on. Okay, now you can put fluids in there, you can fill it through here, you can put fluids in there, you can draw fluids from it. Okay, but it is mostly for simulation purposes. Okay, so both sides. Okay. That one's really easy. And it's actually pretty easy to clean as well. You just kind of press the tab and pop it off. Okay, and they are connected. Okay. All right. Now, as far as Susie's GYN capabilities, okay, you can do speculum exams and things of that nature, but keep in mind that the vaginal attachment is like a vinyl, okay, but you can still do those procedures. She does come with several different uterine and cervical attachments. Okay, I'm sure you all know that. So I have one here. So basically, the way you're going to do this, okay, is it's kind of like a twisting motion. So let me show you. So I have one here, and I have one of the cervical attachments. So see this round piece here, right? Here's my uterine attachment. Okay, you have the uterine attachment, and you have the pieces, the cables here that kind of hold it in place, kind of like how this one is, right? Well, this one's not in place, but basically it's kind of like that. Okay, so the cervical piece connects with these 4 pegs. Okay, they attach, and then they twist together, right? You just twist it and lock it together, okay, onto Susie. But the way it works, okay, so let me take off the one that's currently there. So what you have to do is you have to put fingers into the vaginal attachment to hold the cervix piece in place, and then you twist. Okay, so let me show you. Is there any way you can move the camera to show this? So like I said, you put 2 fingers in there, 1 finger in there, right? and you hold it in place. So that's where the cervix attaches. Okay, and there's those 4 pegs, right? So right here, right? So they connect through those 4 plastic pieces right there. Okay, and then you take your uterine attachment up this way, place it, and then twist, and it locks on just like that. Super easy. Okay, and you can take these out. You can replace them with different ones. You can take out the cervical attachment, and you could place it with a different one, right? You get all the different ones, kind of like these. Some are open, some are not. Some have various disease processes. Others are dilated. Some are more dilated. It's a lot of different pieces that you get with her, right? So again, if I was going to do this, right, we'd take our uterine attachment. We'll just kind of place it right there. Take the cervix attachment that we want to use, place it through the vaginal attachment, match up those 4 pegs. That can be kind of challenging, but you'll get used to it. Takes a little bit of practice. Okay, so there we go. So I got that. Okay, and then we place the uterine or the uterine attachment, twist to lock it. So you're basically twisting it this way. Okay, twisting it to locking it, and then you have the structure pieces. Now, one thing that's very important is that this, what the uterine attachment and the cervical attachment connect to is plastic. Okay, it is kind of a thin plastic, and it can break. So don't try to be careful with it. Okay, because that plastic piece can crack. So you basically just do that, and that's how you connect it. Okay.
Josh, if they
put,
were to insert a pessary, they would just put mineral oil on it and slide it through the vaginal canal?
yes, but what is that real quick?
It's a ring to hold up the uterus that goes in the vagina
Yes, I think
to
so.
prevent prolapse.
Yes, absolutely. Yeah, because you can do things like that, and you can do like, with the clear ones with that are kind of hollow. Yes, yeah, you could do that. Absolutely. Sorry, I had to see a picture of it. So, but you can also do like with the clear uterine attachments that are hollow, like you can do like IUD placement and all kinds of stuff. So yeah, absolutely. Yep. Is that helpful? Did that answer your question?
Yes, just wanted to make sure everybody heard that mineral oil to slide it in.
Yeah, absolutely. Mineral oil, 100%. Yep, absolutely. Okay. All right. So, and then when we put the the stomachs back on, like our regular stomach skin back on, right? You always want to make sure that your abdominal sites match up. Okay, place your Velcro back on, and then we're good. Now, one thing with your bowel sounds is you don't necessarily get them from like this spot here where it's hollow, like where, right here. You don't get it here. Like you get them on the side. So listen for it on the side here and the side here. That's basically where the speakers are. Okay, so here and here. Okay. All right. Now, the other thing with Susie is she does have bed sores. You get both bed sores. Okay. Or both sides, I should say. So basically where her kidneys would be, if you reach under, you'll find these. So this is kind of like no bed sore. And then this is not for her, but your bed sores kind of look like this, right? So you can, treat these, pack these, dress them. You could put moulage on them, but basically it goes right under where her kidney would be, and there's a spot to place those. And so she does have bed sores. Okay, so those are your bed sores. This is if you didn't want a bed sore. So my Susie currently does not have bed sores. Okay. All right. Any questions or any other questions so far? And then of course your abdominal G-tube pieces here. Let's see. There we go. For your ostomies, right? So you get those. Okay, so one here, and then there's one here. Okay. All right. Let's see. All right, y'all ready to talk about software? Does anybody have any questions before we move on to the software? Okay, let's talk about the Omni 2 system real quick. So what I'm going to do is I'm going to kind of show you my screen real quick, because again, with my emulator system, I can't actually connect to her with it, but I can show you what we would do. So with her, she does have the Bluetooth capability, right? So your Bluetooth button is going to be on her right side where the charging port is. Okay, so can y'all see this pretty well? No, can't see it at all. Oh, sorry. How's that? Can y'all see that? No?
Not the
Sorry.
best.
Not the best. Okay. Okay, how about like that? No? Okay. Yeah. Okay. So here, let me show you this way. All right. I'm just sure. Okay. How's that? Can y'all see the Omni 2 screen? Okay. So basically the way it's going to work is, and what you kind of couldn't see on my Omni tablet is that it will say the mannequin that you're connected to up here. See how mine says disconnected? It would say Susie S901 right here. You would also have your serial number, and then you would have a series of green dots. Those green dots represent your signal strength, okay? And that you're connected.
One moment, please. Wait a second.
Yeah, no, you're good. Okay, so yeah, so that's kind of what it would look like when you're connected. So basically, in my system here, right, and you're going to connect to the mannequin that you're paired to. So if you have other Omni 2 systems, you could use the same tablet to pair to other mannequins, right? But we're talking about Susie, so I need to go to Susie. See, because you might notice that I have a labor button here, and Susie does not give birth. So I need to switch that. Okay, so what I'm going to do is I'm going to go to my settings here. Okay, you have a whole lot of settings that we can talk about. And I'm going to go to, I'm going to select the simulator. Okay, when I select the simulator, it shows basically every mannequin that I can connect to with the Omni 2 system. One thing that you might find interesting is notice I can connect to Supertory on Omni 2. Do you see that, Danielle? Did you know that? Did you know you can connect to Supertory through Omni 2?
No,
Isn't that crazy? Like I learned
That's
that
wild.
maybe like a little while ago. Yeah, it's pretty cool. So let's go ahead and go to Susie S901, and it will load basically her settings. Okay, so here we go. And this is all of them. I'm double checking on my software. It's all of them except for the streaming audio, which is unfortunate. So, and our blood pressure. And that's kind of the downside to being able to teach the software. Because it's an app, I don't have like a Windows version that I could teach with. So I'm missing a couple of things, and I'll point those out. So basically, this is what it's going to look like for the Susie 901. Okay, but see here where it says session time? Underneath our session time, you're going to have 3 buttons. Okay, and those three buttons, one of them is going to look like a microphone, one will look like a headset, and one will look like a headset with a microphone. That is basically your streaming audio, okay? Because you can do streaming audio with your Susie, meaning you can listen through her and you could talk through her if you want to pretend to be the patient. So the button on the left that would be here is going to be your microphone. Click that button, you're talking through your Susie. To the right of that, you would have a headset. If you click that button, you're listening through your Susie. To the right of that, just under the timer here, you will see a headset and a microphone. That is full duplex. Okay, full duplex meaning talking and speaking through your mannequin. Underneath these items here, so these menu items, you will see a volume slider, and that does adjust the volume of your mannequin, listening and talking. Okay, so I apologize, y'all can't see that, but it's just the limitation I have, unfortunately. So let's talk about these features here real quick. These features here are kind of like your bread and butter, okay, for running your mannequin. Okay, so what I'm going to do, if we have time, I hope we have time. Are we good on time, Danielle?
I think we're going to go over, but just keep going and hopefully everybody can stick around. Otherwise, we'll record the whole session so that if you need the video, we can share.
Okay, cool. Okay, yeah, sorry. Yeah, sorry. All right. So basically you start out the software with your favorite vitals. Okay, so for my Susie, these are my favorite vitals. Okay, these are the vitals that I have favorited. If I click this one, it shows all of her vitals. Okay, so notice how I have a list of vital signs here that are broken down by category. Okay, notice how I have a plus sign here. There's a plus and a negative. If you see a vital sign that has a negative next to it, it means that it's in your favorite. Okay, if I want to add more, like if I want to add throat sounds, click the plus and it adds it to my favorites. So now throat sounds is one of my favorites. Okay, if you want to take it away, just click it again, make it a plus. So as far as your vitals go, okay, vitals on Omni 2 is extremely easy to change. Okay, there's a couple of different ways to do it though, and I'm going to show you an easy way to run your Susie to make it more efficient for you. Okay, this is going to be the way that I recommend doing it. Okay, so let's say I want to adjust her respiratory rate. Okay, we're going to click respiratory rate, and you have a couple of options here. Okay, I can hit the plus. Okay, I can hit the minus, go up or down. Okay, so 13. I can slide the bar. Okay, or we can change by a percentage. If you change your vitals by a percentage, so those are going to be like respiratory rate, heart rate, blood pressure, things like that. Okay, if you change your vitals by a percentage, a lot of times that's more realistic depending on what you're doing. I highly recommend adjusting vitals by a percentage if it works for you. Okay, because like I said, in a lot of situations, it's more realistic. So all I have to do is click that. The slider goes in the middle. Okay, so if I go to the left, it's -%. If I go to the right, it's +%. Okay, I also have an apply now. So let's say we lower the respiratory rate by 30%, and I hit apply now. Okay, so right now the respiratory rate went to 9. I think it went from like 12 to 9. Okay, click it again. Okay, let's go back up to like 20, 25. Apply now. Okay, so you always just hit apply now to make that vital sign change right now. Okay, throat sounds, anything with sounds, you basically get a list. You just click what you want on the list and it'll happen, right? Apply now. Okay, there's also a volume slider. All of your sounds always have a volume slider, up or down, high or low, right? So that is when you're auscultating with a stethoscope, volume up, volume down. Okay, So I choose what I want, inspiratory stridor. Let's go, apply now. Okay. Now things like blood pressure, I get 2 slider bars, one for systolic, one for diastolic. Okay. Things like finger bleeds, right? She has a left middle finger bleed option for glucose, right? So we're going to click that. That is going to be a toggle on or off. Okay, some are on or off toggles, some are list of things, choose what you want, right? And then the other is the slider bar with your vital sign changes, right? Most of your sounds work this way with your choosing from a list, right? Normal vowel sounds, hyperactive vowel sounds, borgamous vowel sounds, right? Remember your lung sounds are right and left anterior, okay? So with the apply now, it applies it right now, okay? Let's talk about the cue system real quick. The cue system is really something that you're really going to like, and it's something that you should always use because you can do a lot with it, okay? So with the cue system, basically what that does and what I can do with that is I can change vitals and I can trend them over a specific period of time. And I could choose which vitals do that. And that they all go at the same time at whatever trending time I select, right? So let's pretend I'm going to do like a basic chest pain, right? I'm doing the initial onset for basic chest pain. Susie is just getting started on going into a sim for chest pain. Okay, so what I want to do is I want to start with a vital sign that's relevant to what I'm doing, right? So maybe heart rate, right? Let's say that her heart rate is going to be low. So she's going to be bradycardic, right? So I'm going to bring it way down, like the 30s. I'm going to add it to the cue. I'm adding it to the cue because I'm not changing it right now because I want to add more to it, right? So notice now how her heart rate is 75, but I want to trend down to 33. Okay, that's in my cue. It's not happening yet, but it will in a minute. Okay, so let's do blood pressure next. I'm going to click blood pressure. We're going to cue that one down. Okay, so 83/52. Blood pressure is bottoming out. Okay, add that to the cue. Okay, let's go ahead and we'll go back to cardiac rhythm. I click my cardiac rhythm and I choose from a whole lot of pre-built rhythms, right? So we're going to do 3rd degree, add to cue. So she's going to be in a 3rd degree block. She's not having a good day. Okay, and then we will go to, let's do O2 sat. Maybe her O2 sat's low, and then we'll call it good because I think y'all kind of get the point. So we'll add to cue. All right, so you have a couple of options here, okay, and those are at the bottom. Okay, so I have those vitals in the cue right now. Okay, so I can click this button here that says seconds. If I click it, it changes to minutes. So if I want to trend these vitals over a minute, I click minute, and then I slide the bar over to 1 minute. Okay, so now we're at 1 minute. I hit apply now. When I hit apply now, notice up here at the top, it says trending. And now these vitals are actually trending. Okay, sorry. These vitals are actually trending now over a minute. So at the end of my minute, what I put in my cue is what my vitals will be after that minute. Does that make sense? Does anybody have any questions with that? So I'm basically trending my vitals. Okay, so let me show you the thing to help you out, right? What's going to help you out and what's going to make you using your Susie a lot more efficiently is going to be to create palettes. Okay, if anybody has ever heard the term palette, that is basically a palette is the same thing as a group of vital signs. It's the same thing that you put in your cue. Okay, so think of a palette as like a painter's palette, right? With a painter's palette, you have multiple colors. With a vital signs palette and Gaumard, it's multiple vital signs, right? Instead of vital colors, it's vital signs. So what I recommend is creating a bunch of different palettes that represent different things that you might use a lot, right? So if I'm going to do this chest pain scenario a lot, I would create a palette that has those vital signs already saved, so I don't have to keep recreating them every single time, right? And those palettes go into your palette menu. Okay, so your palette menu is right there, right? It looks like a palette. Okay, thanks. Your palette menu is right here. So if I click on it, these are all the palettes that I already have. See, I have one called chest pain already, right? So if I load that one, okay, it's going to load those vitals, okay? And you can put them in a category and everything, okay? So what I recommend, cancel that. Let me create one real quick and I'll show you guys, okay? So we'll only do a couple vitals. Let's do heart rate. Let's say it's elevated this time, right? Add to queue. And we'll do blood pressure. We'll raise it this time. Okay, like pretty high. Add to queue. And then we'll do respiratory rate and call it good. Okay, so let's say respiratory rate this time is low. Okay, add to queue. So those 3 vitals. Okay, so now, if, like I said, if these are a group of vitals that I'm going to use a lot, okay, I want to save it. So I'm going to hit this save icon here. It looks like a floppy disk, right? So click that. It'll allow me to name it. So let's go ahead and we'll call it hypertension. Hypertension. In the description, we'll just say, you know, IBP with, you know, low respiratory rate, right? And then we'll put it in category. So remember, your categories are nothing but organization, right? So like what I think is critical, you might think is care required, and it doesn't matter. It's just for organization. So for this one, I'm just going to put care required, and I'm going to save it. So there you go. I just saved a palette, and I saved myself time, so I don't have to keep recreating these vitals one at a time, right? Because that's slow. Your students have to wait for you. So now if I go to my palette menu, okay, there's my hypertension. Okay, so on a normal use basis, so how does that help you? Okay, so let's go ahead and I will make all the vitals normal again. So if you want to reset your vitals, hit the green square here with the white heart. Okay, it takes all your vitals and it puts them back to normal. So now let's say I'm running my Susie. I just started Susie. And I'm like, okay, we're going to start this chest pain scenario. Okay, this is the best way to do it. I don't have to change these vitals one at a time because I have that palette that represents my chest pain scenario. So I'm going to go into my palette tab, click on chest pain when I'm ready. Okay, students are ready. Yep, let's go. Okay, so I'm going to hit either load or I have a little stopwatch here. This can allow me to trend chest pain 1. So let's go ahead and just do that, just for the heck of it. So we'll go up here. So these are seconds, and then the other is minutes. So let's not do that. Okay, so like that, right? So hit OK. 53, chest pain, load. Okay, so now we're trending chest pain. See now here how it says chest pain 1? Now we're trending that. And my student is seeing that. I didn't have to click all those vitals one at a time, right? So much easier to do it that way, right? Now let's say, oh, the student's going to treat the patient or they're going to do something, and now I need to go to a different set of vitals, right? Okay, go back to my palette menu. Maybe let's do the hypertension one, right? Trend that or don't trend it, hit load, right? Now we just loaded the hypertension one. Right? Doing this, going to your palette menu saves you a whole lot of time, right? And then if there's instances where you don't have a palette for something, then yeah, maybe change it here on the fly or change it in your favorites, right? That's what your favorites are for. Okay, does anybody have any questions with that? What do you guys think? Was that helpful? Okay. All right. So you also have your CPR tab. Oh, Brandy, did you have a question?
No, sorry, I clicked the wrong button.
Oh, okay. Awesome.
you.
Okay. No worries. Okay. So yeah, so you have your CPR tab. Let's talk about the CPR tab. This is a great way to evaluate and measure your student's CPR. There's a lot of different things you can do with this. You can actually get a report. Okay. So if I take my mannequin, let's see. No, let's go to vitals. If I take my mannequin and they die, let's go ahead. We'll go to cardiac rhythm. VFib. Coarse, very coarse. Let's do very coarse. By now. Okay, so VFib, my mannequin is dead. Right? So we're gonna go back to the CPR tab. Okay, now this right here would be compressions and ventilations. Okay, so as your student is doing compressions and ventilations, you will have these bars go up and down. If you can get this black bar and this one here to hover in the green, that means they're doing proper CPR. Same with this graph here. Now, if I press start, it will give me a report at the end. It will actually evaluate your student's CPR and it will give me a report at the end. Okay, so now if they're, let's pretend somebody's doing CPR and they stop, they're done, they finish, right? We got through our mega code, whatever. I hit stop and then I get this report, right? So remember, your tablet is an Android tablet. You can hook up a network printer, a wireless printer to your Android tablet, a Bluetooth printer, whatever, and you could put in who the compressions were done by, who the ventilations were done by, and look at all the cool stuff that it tells you. It tells you whether they did full recoil, their rate for compression rate, ventilation rate, right? Their PIP, the rhythm that they were in, all kinds of cool stuff. The date, the time, right? And then you can save it. Save it, and then you can print it, right? That's your CPR tab. Now, scenarios. Now, you can do scenarios with your Susie in Omni 2. Scenarios take a little bit longer to teach, so we're not going to go into scenarios because I know we've gone over already, but keep in mind you can do that. But what I just taught you with your vitals and your palettes, running them manually this way is very efficient. If you like doing it this way and you find it as efficient as I do, you may not want to do scenarios. Or if you do, like I said, that would be something that we could probably another webinar maybe, and I could teach you that later. But in the meantime, definitely do it that way. Okay? So you also have some provider actions. This is where I can put in providers. I can say who's who. I can say my student is doing something besides checking vitals. They performed a jaw thrust. They started CPR, right? They treated a bronchospasm. They used a BVM. Basically, what this does is whenever you click on one of these items, it timestamps it and it logs it for you. Okay, because in Uni, or I'm sorry, not Uni, but in Omni 2, you still have a log. So the log is actually right here. Okay, so this is everything that I've done to the mannequin since we've started. This is my log. Okay, notice you can save your log. Once you save it, you can print it. I can delete it and we can start over again. Okay, so that's my log. Okay, so again, provider actions, my log, the settings. Okay. All right. We also have the blood pressure icon. You do have the blood pressure icon here. Basically, when you click on your blood pressure icon, it shows you your blood pressure gauge, like a virtual blood pressure gauge. and you could watch on the software as the student is checking for blood pressure, and it shows you the ranges in where the blood pressure is set. Okay. And then you also, next to the palette that you can't see, you have your streaming audio and your pre-loaded audio options, right? Where she says things. Let me see if y'all can hear this. So like,
I think my ankle is broken.
right? She said she thinks her ankle's broken.
I feel dizzy.
Right? I feel dizzy. I feel weak.
I feel weak.
You know, things like that. Okay. So as far as Omni 2 and the software, basically everything that we've talked about so far, does anybody have any questions? Right. I really hope that this was helpful. I really hope that everybody learned something today. If there are any specific questions, you know, maybe you know, get with Danielle and we can coordinate something, or, you know, I'd be happy to answer any questions later. But yeah, hopefully this was helpful. Hopefully y'all enjoyed it. And yeah, any last minute questions? Or Danielle, did you have anything to add?
Nope, I'm pretty good, and I look forward to working with some of the teams that I haven't had an opportunity to meet yet.
All righty. Well, that's all I have. Y'all have a great weekend. Enjoy the rest of your day. And we'll talk to you next time.
Thank you so much, Josh. Thank you.
No problem. Talk to you later, Mohsen. Thank
Thank you.
you.
Bye.
Thank you.
Yep. No
you.
problem. Thank you all. Have a great one.